Now I'll be preparing our machine for anesthetic procedure. First thing is I'm going to check our oxygen supply, and I'm going to turn on our oxygen and make sure our valve is in working order and that we have plenty of oxygen for our procedure today. This is a 2,000-pound tank. We have around 1,200 pounds, so we have plenty of oxygen for our procedures today. Our oxygen line is hooked up to our anesthesia machine, so I'm going to make sure that our anesthesia machine is receiving the oxygen. I'm going to turn the valve for the flow meter for the oxygen. The ball here is showing that we're getting about 2 liters per minute. It is maintaining in that position, so it is getting adequate oxygen supply. Go ahead and turn this off for now. The next thing I'm going to check is our soda lime canister, which is used for carbon dioxide absorption. These are fresh granules. They should be changed every 6 to 8 hours of use, or if you're noticing any kind of color change. But these are fresh and good to go. And then now we're going to check our vaporizer. We want to make sure we have enough of the inhalant anesthetic in there. This is an isoflurane machine. So we're going to check this little window here, and we are actually running a little bit low on the isoflurane. So here is our refill. So I'm going to uncap it here, and I've got our isoflurane, and I'm just going to pour it in and watch for it to fill. All right, and we are now at full. I'm going to recap. I'm also going to check, make sure our vaporizer dial moves nice and smooth. So you can push down here and spin. Does spin without any issues or concerns. Next, I'm going to attach our breathing tubes to our machine. So I have a universal set here. So we're going to place one on the exhaust pipe and then one on the inhalation pipe, making sure they're nice and secure. And so our tubes are connected with the Y piece here. I'm going to place a 2-liter bag on the machine to perform our low pressure leak test. First, before I do anything, I do like to check, especially in this area here, see if there's any rips or tears. The leak test will just make sure our machine's not leaking. We'll make sure we've got a good bag and there are no visible tears or holes. Again, I'm going to place it onto the reservoir bag place and make sure we have a nice secure seating of that. So now, for our complete flow of oxygen anesthetic to the patient, we have our oxygen source is attached to our machine. The machine receiving fresh oxygen. We'll turn our vaporizer on. The vaporizer and the oxygen are transferred to the patient via our breathing tubes. This is where we'll attach the ET tube to our patient, and they will exhale. The carbon dioxide will be scavenged through the soda lime, and then we also have a scavenger canister there at the bottom as well, so that there are no wasted gases eliminated into the air. So now I'm going to perform a low pressure leak test. So what we're going to do is I've got the 2-liter bag on. I'm going to hold on to the tube. I'm going to occlude the end of the piece. I'm going to close our pop-off valve. Make sure it is all the way down. I'm going to turn the oxygen, just the oxygen, no anesthetic, onto 2 and allow our bag to fill up. It's going to take a minute or two to fill. But once it has filled, I'm going to decrease the oxygen from the 2 liters to about the 200. I'm going to slowly decrease it down. And now, as I apply pressure to the reservoir bag, we're going to watch the gauge here and make sure that it maintains around the 20 pressure. I'm going to hold that. There are no leaks. It is maintaining at the 20. So I can safely say that our machine has no leaks. I'm going to go ahead and release the bag. I'm going to unocclude here and turn off our oxygen. And then I'm going to make sure our pop-off valve is open. And now our machine is ready to be used.